I'm Rick Buck, and I've been a dentist for 17 years. Today, I will be extracting all of the upper teeth and delivering a full set of dentures on this patient. You can see he's missing a lot of back teeth, and he's a strong guy. And that means each time he bites down with less teeth, the few teeth that he does have are absorbing a lot more pressure, and it is causing all his teeth to constantly ache, and it makes eating all but impossible for him. So when we take out teeth, we start by doing a series of injections to numb the whole upper arch of teeth. Once the patient is numb, I'm going to remove the upper right second molar. I start with the periosteal elevator to separate the gums attached to the tooth. Then I take out my elevator. With a firm grip on the elevator, I gently wedge it between the tooth and the surrounding bone, applying controlled pressure to loosen the tooth from its socket. I can feel the resistance of the ligaments and the bone gradually giving way as it quickly starts to loosen. The bone is quickly expanding as well, and the ligaments attaching the tooth to the bone break speedily. Now, if you're used to watching extractions, you can see this is kind of happening kind of quick, mostly because the pressure this patient has been putting on these teeth has already made them kind of loose. As the tooth begins to loosen, I take my time, ensuring minimal trauma to the surrounding tissues. Eventually, I use forceps to rotate and put pressure on the tooth until it breaks free. You will note that this happened a little quicker than some of the other extractions on my channel. Now I'll move on to the first premolar. With a steady hand, I navigate the elevator, delicately moving it between the tooth and the bone, applying calculated pressure to gently detach the tooth from the socket. It's moving pretty quickly, but not as fast as the previous tooth I just extracted. Transitioning to the forceps, I grasp the tooth firmly, employing a controlled rocking motion to dislodge it. Still, the tooth is not coming out very quickly, so I will alternate between the forceps and elevator. Now, you should know that this isn't the first appointment that we've had. We've had many previous appointments where we started making the dentures, so we are fairly confident that the day we take these teeth out, that he will immediately have dentures to go home with. Finally, the premolar yields, and I conduct a thorough examination of the extraction site to confirm a clean removal. It's interesting because this premolar has 3 roots, which is pretty rare. Anyway, it's a gratifying moment knowing I've executed the extraction with precision. Okay, now we move on to the incisors. Immediately when I start to rotate the lateral incisor, I can tell that the tooth isn't as loose as the premolars I just extracted. So my plan here is to actually alternate taking out all the incisors and start getting them all loose. If you put pressure on these teeth, the inflammation process will start, and that will help extract more easily by just giving them time for that inflammation to start the destruction process of the ligaments. Now, I don't want to go too fast if they aren't ready to come out. You see, you can take these teeth out really fast, but in this case, you risk pulling out fractured pieces of bone with them. Sometimes big chunks of bone can come out if you try and do this too fast. Now, that isn't too bad in some cases, but here the bone will help the retention of the dentures, and you will see later how that is an issue anyway. Now I move on to the elevator for a moment, and I can tell that the pressure really has the lateral and the central moving better than they were. You can't see this, but I can feel the central incisor is really loose. So I will start to extract that tooth first. So I go back and forth with rotational forces on both teeth, and when I get to the central incisor, it really starts to come out fast. It's a clean extraction without pulling any bone with it, so I am happy. Oh yes, on the front teeth, I try only to use rotational forces if at all possible to take them out, and a little bit with the elevator, which puts a lot of lateral pressure on the tooth. I don't want to pull forward on the incisors because that can break the bone pretty easily, but if I wanted to, they would come out faster if I did that. Now, that lateral incisor is just being stubborn. It's loose, but it does not want to come out at all. So I will move on to the other central incisor, and with just a little more rotation after I put pressure on it, the tooth just starts to come right out with a little pop. So some teeth pop out, and then others have this slower release. I know it may sound odd, but they have a gratifying feeling when they come out. The slower release, in my opinion, is more gratifying because you can really feel the ligaments ripping free. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best. posted at the end of this video so you brush and floss with superior results. Okay, back to the stubborn lateral incisor. I keep pulling and rotating. I do it for quite a while actually. Sometimes people equate how good of a dentist you are by how fast the teeth come out. As you can see, the same dentist in the same mouth but with different teeth can affect the speed of how fast the teeth are coming out. So I always start with a tooth that I think will come out fast, so they start by thinking that I'm a great dentist, even though other things make a dentist great, like taking out the teeth with as little trauma as possible, as I explained earlier. But finally, that lateral incisor is coming out to join its neighbors. I mean, you can see this tooth took a while and longer than the premolars with multiple roots. So you just never really know, because lateral incisors are normally the fastest teeth to come out. Speaking of stubborn lateral incisors, this next one is pretty stubborn too. I will do a little fast forwarding through the extraction of this tooth for you, but this one kind of pops and it's completely loose and ready to come out. I don't know if you noticed, but the right side didn't have a canine to come out. This left side does, or it sort of does. The tooth broke off and this is the root of the tooth left behind. You can see it had a root canal done on this in the past. I'm a little worried because many things could make this tooth difficult, and it's broken, so there's not much to grab onto. It has decay, so it can easily break when I grab it with my forceps, making it more difficult to take out. And teeth with root canals are also more brittle, also increasing the risk of it fracturing. Lastly, it's a canine, and canines normally have some of the longest roots in the mouth, making it more difficult to extract them. Luckily, my worry for this tooth has been for nothing. It didn't break, and its roots were actually quite small, especially for most canines. And with a little caution and time, the tooth loosens and comes out quite easily. And now I move on to the premolar on the left. I first go in with my elevator. With no teeth on opposite sides of these teeth, when I put pressure on one tooth, it will put pressure on the other tooth in the other direction as well, which loosens them both simultaneously with each rotation of the elevator. Now that I have them both wiggling with pressure, I will start by removing the first premolar with my forceps. Now you can see the tooth comes out pretty easily really, but you may notice one thing: only one root comes out. The same tooth on the other side unusually had 3 roots. This tooth had 3 roots as well. As I just explained, root canal teeth like this one can be very brittle, and 2 of the roots broke off while I was extracting the tooth. Luckily, as I go back in to remove the pieces, they each come out easily as well. If you have watched some of the more difficult extractions I've done, you know that the configuration and orientation of the roots just won't allow a tooth to be extracted in one piece sometimes. Well, now that I have all 3 roots out, we are on our last tooth, and this one comes out pretty quickly as well, with just rocking it back and forth for a minute or 2. Overall, all these teeth are coming out really easily, and such is the case with most people getting immediate dentures. People mostly get dentures as a last resort, and by then, the body is ready for the teeth to come out. So after they're all out, we clean each of the sockets with a spoon and ozonated water to remove the bacteria. Now, with all of them out, we move on to putting the denture in. There's a problem you can see that is common with a handful of immediate dentures. As I put the denture in, it isn't very stable at all. It kind of rocks back and forth, and as it is right now, it doesn't suction and stay in place as immediate dentures are supposed to do. There are a few reasons for this. 1, there is a lot of inflammation from taking out the teeth today. 2, I injected the tissue with anesthetic at the beginning of the appointment. 3, the dentures were made with an educated guess as to what the tissue would look like with the teeth out. This isn't always the case. I am working on a video right now where the immediate dentures fit extremely well. But we put this white paste on the dentures and put them in the mouth. This white stuff is pressure indicating paste, and I can see for the most part where any big inaccuracies are in the denture. I just adjust any high spots on the denture and do this a few times. By the end of the appointment, the dentures fit pretty good, And as the swelling goes down over the next few days, they will fit really well. One thing that almost all denture patients are happy with are the look of the teeth, because they look better than what the patient had coming into the appointment. Dentures are a work in progress, so they will fit well, they will become loose again, and you'll have to refit and reline them over the next weeks and months. And to keep them fitting well, you'll have to make adjustments as they start to loosen or have other issues. But it's much better than going without teeth for a few months until everything heals. A lot of times these things will suction right into place. Everyone is different, and it just kind of depends on a lot of things. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.